So this is part 2. In this section, we're going to talk about a different technology used for biofilm stain removal. And it has a couple of different names: air powder, airflow, air powder polishing, Profi jet, all those different names. And they're basically the same genre of biofilm and stain removal. So basically, air powder polishing can be a very effective and efficient use of stain removal. It works very good, but it tends to be a little more abrasive. So the powder that they use is called sodium bicarbonate. And basically, that used to be used in Profi jet air polishing units, and this technology has been around for a while. What's a newer version of these is the newer types of powders that you can use in many different situations, and is also effective but yet not abrasive. So let's first talk about the technique that we've had for a while, which is air polishing for traditional stain removal. So this is the nice time to use something like this is if you have a patient that's going to quit smoking, so you can get rid of all their stain and they're going to look great. So sometimes it's an incentive for a patient. It's nice to use. So basically, this technique, it uses air and water and sodium bicarbonate, and it delivers a controlled spray and it propels the particles to the tooth surface. It can make a mess. Not everybody is going to like it. It can be pretty powerful. So it's basically the air pressure is between 40 to 100 psi and the water is 20 to 60. And the way that you use this device is you keep the nozzle in a constant circular motion, and you're about 4 to 5 millimeters away from the enamel surface. And the angles that you approach the tooth are to be for effectiveness as well as deflect the aerosols. And I'll go over that in a little bit. Basically, it doesn't generate heat. And the sodium bicarbonate can be abrasive, but it still can be less abrasive than many Profi pastes. It does can be very helpful for those tobacco issues. It's very good before ortho. It's also very good for prior to sealant placement, especially if you have stains and pit and fissures that are traditionally hard to remove. That works well. Sometimes with other bonding procedures, sometimes used as a root detoxifier. So basically, the contraindications for sodium bicarbonate are anyone who has a low sodium restricted diet, anybody that's on medications that affects the acid-base balance, diuretics, that kind of a thing, can be contraindicated to the sodium bicarbonate powders used for air polishing. Now, the other contraindications are basically the same contraindications for the newer technology, the airflow, the glycine, erythritol powders. These are still the same contraindications. So patients with respiratory disease, problems swallowing, end-stage renal disease, anything that's communicable disease, patients receiving chemo or radiation, a history of allergies to any of the powders that you're going to use, and some specific dental conditions. If the tissues are really moderately edematous and really inflamed, you'd really want to be mindful and reconsider this. It can cause pitting in restorative materials, so you need to be careful and you need to know which powder you're using and when it's safe on which dental materials. You have to avoid, when you're using the sodium bicarbonate, only on enamel. It's contraindicated on cementum and root surfaces. The erythritol and glycerin powders are fine and safe to use on the root and most restorative materials. So you need to think about the aerosol production when you're using these types of devices because they do generate a high aerosol environment. So you're going to have to do your traditional pre-procedural antibacterial mouth rinse. You need to use a high volume evacuation. You just can't use the slow speed. You might use it in addition, but not to replace high speed. You may want to use a non-petroleum lip lubricant on the patient's lips to avoid any kind of irritation. And you must be diligent about PPEs for you and your patient. So generally, when you're using the nozzle, you want to make sure you're about 3 to 4 millimeters away from the tooth surface, and you're going to use short sweeping motions. So, and here are the angulations on one slide, and then I'll go through them. So on interior teeth, again, you're about 3 to 4 millimeters away from the teeth, and you're generally about 60 degrees away from the tooth. You want to avoid aiming it at the gingiva, and you really want to keep the aerosols deflected. On posterior, this is the 80. You want to, the tip should be about 80 degrees to the facial and lingual surfaces of the posterior teeth. So here's showing you some incorrect angles and where you're going to have deflection, and it's going to be problematic for the gingival margin, especially when you're using this with a sodium bicarbonate or a powder that's not appropriate for the tissues or subgingival area. On the occlusal surfaces, you're going to use it at a 90-degree angle. So with use of a standard nozzle, on these, you're depending on the powder, again, that you select. You could still use, this is the newer technology, but you could use a sodium bicarbonate if you had a patient that had stain, you might need that. With the new generation of erythritol powders, you tend to have the balance of kind to the tissue as well as stain removal. So you'll probably get away from using the sodium bicarbonate. But here are the newer nozzles, and these should be used about 3 to 5 millimeters away from the gingiva, especially when you're using a sodium bicarbonate. So the for interior teeth, you angle between the tooth is 30 to 60. So not straight at the gingiva if you're using an aggressive powder. And definitely not on the tissues. So when you're using the supragingival nozzle and nozzle placement, you're going to almost like create a little smiley face pattern over the coronal portion of the tooth surface for about 1 to 2 seconds. And this is just showing the use of the evacuation using the high-speed placement when you're using the air polisher. And sometimes that's, which requires a lot of practice, is just kind of handling both devices. So like I mentioned, the new generation powders, erythritol and glycine, have been a very nice adjunct to dental hygiene care. And you can use both these powders subgingivally. So they're used for subgingival biofilm removal and supragingival biofilm removal. They're great for maintaining perio patients, and they are safe to use on implants and have been found very effective for biofilm removal and maintaining implants. So they have received FDA approval for using on for 5 millimeter probe depths. So basically indications are biofilm, stain removal, use on enamel. You can use them on cementum dentin. You can use within the sulcus, in a perio pocket, on restorative material, for sealant placement and implants. So many helpful places, really. And like I said, the erythritol tends to be better for stain removal than the glycine. So air polishing to remove biofilm from the root surface is relatively a new technology. So you wouldn't use the older technology, the Prophy jet that was traditionally used for the sodium bicarbonate, and use glycine powders. You really have to make sure that your system is harmonious and you're using the right powders with the right system. So clinical research has supports its safety and efficacy for non-surgical perioral therapy. The standard metal nozzle delivers the glycine powder in pockets up to 4 millimeters. And then when you want to go subgingival, you can use a site-specific perio tip for pockets that are greater than 4 millimeters. So basically, by just using the supragingival attachment or nozzle and using it at the gingival margin, you can actually remove the subgingival biofilm up to 4 millimeters without even going subgingival. So then if you need to go deeper, then you can use the subgingival attachment. So basically, the FDA has approval for up to 5 millimeters. In Canada, they have approval for 10 millimeters. So basically, and you need special training. You need to know how to use these devices safely. So what is the glycine? It's basically a non-essential biocompatible amino acid. It's low abrasive powder. And it's very fine, round, and soft particles. And it's very gentle on the tissues. And it feels very gentle to the patient as well. So these were first evaluated and used in Europe, and then started trials here in the United States. So that's been fairly recent here. And it's the glycine powders are about 80% less abrasive than the sodium bicarbonate. The erythritol, again, can use both subgingivally and supragingivally, and it's better for stain removal than the glycine. So some contraindications for the glycine are respiratory problems, patients undergoing chemo or radiation, patients with a communicable infection, or history of allergies to these powders. So there is a very strange side effect, and it's very rare, but it's a facial emphysema. It's a very rare condition, and it's the accidental collection of air in the soft tissues of the face. And this is caused by pressurized air in dental procedures. So the symptoms are face swelling and can happen very quickly after treatment, crackling feeling of the face and neck, tenderness, and pain. So you want to make sure that the patient seeks medical help right away. And it's important to identify what is going on, because many times people in healthcare may not be familiar with this. And sometimes they might mistake it for an allergic reaction. So this has been reported in the literature after high-speed dental drills. And basically it estimates the probability of this happening is very rare, but you want to be mindful of its condition. So aerosol productions. Aerosols are created when we're using all these stain removal and biofilm techniques. And it's basically airborne particles that are composed of debris, microorganisms, and blood that are propelled into the air from the patient's oral cavity. These aerosols are small droplets which can remain suspended in the air for many hours. And it's important to consider these aerosols and try and control them. So the microorganisms that are in the mouth and respiratory tract can be transported to these aerosols and can contaminate skin, mucous membranes of patients and dental personnel. So aerosols stay airborne and float on office air currents moving some distance from point of origin, risk of contamination continues long after the procedure is over. So this always kind of grosses you out, right? So this is why we do all the things that we try to do to reduce aerosol creation in the dental environment with the pre-procedural rinse, with high evacuation, all those things. So we use that vent style evacuator tip, high speed. There's all different types of devices to help you with that. So patient preparation, you're going to explain to your patient what's going on, what you're doing, and you want to make sure that you're doing all the traditional PPEs. And this is something you might not see. It kind of looks like for the clinician a mask. Sometimes these are available for your patient, because sometimes even when you're using it, the patient can smell it and all that. So these are available and kept with our equipment. So you want to make sure to remember you got to wear a high filtration mask when you're doing high aerosol creations procedures. You also want to remember to change your mask every 20 minutes when you're doing high aerosol procedures. So now the use of standard nozzle with using the glycine in shallow pockets. So basically, this is now you're going to aim the unit 3 to 4 millimeters away from the tooth structure and aim it right at towards the gingival margin. So you're not right like on the gingival margin, but you're a few millimeters away, and you're using that short smiley face. And the high evacuation is right there. And which is amazing about this technology, through propulsion, it's actually going to clean the subgingival area. So without even entering subgingivally, you will clean it. So using these glycine-based erythritol powders, you can clean the biofilm up to 4 millimeters. And this is just showing you from the lingual what it looks like. And then here is a schematic of what the plastic tip is when you want to go subgingival, when you need to access a pocket, 5 millimeters. You'll put and change the plastic tip on the traditional supragingival handle and put on the subgingival tip. So this is just showing you what it's like on a Typodont. And again, you have to, when you're going to use it subgingival, you have to use the glycine or your erythritol powders. You cannot use the sodium bicarbonate. And when you go subgingival, you have to make sure that there's at least of 4 millimeters of bone surrounding the tooth. So if you have less than that, then it's contraindicated. So here's showing you less than 3 millimeters of bone around the tooth, not recommended. So what you're going to do is gently insert the unactivated plastic perio tip to the base of the pocket, and then slide the tip apically until it makes light contact with the junctional epithelium. Then you're going to withdraw the tip approximately 1 millimeter in a coronal direction away from the pocket, away from the base of the pocket. And then you're going to step on the foot pedal to activate the powder spray and apply the tip for 5 seconds for each aspect of the tooth. Use overlapping vertical strokes, not horizontal strokes. And just so if you try to test this in your hand, it kind of doesn't work. It needs to be surrounded by the tissue. So you might think it's not working, but if you kind of hold your fingers over the tip, you will feel it. So this is showing you the suction and the adaptation of the tip. So then you just have to go site specifically to remove the subgingival biofilm when you have pockets greater than 4 millimeters. So remember that the powder spray will continue for a few seconds after you remove the foot pedal, so you can use your high vacuum suction to get that, so that you're not causing pressure on the tissues and you're not aiming it at the tissues.